Generalized anxiety disorder, often abbreviated as GAD, is a common mental health condition characterized by persistent, excessive worry about various aspects of life. It's essential to recognize that everyone experiences anxiety to some degree. Anxiety is a natural human response to stress or perceived threats, and in many cases, it can be beneficial, helping us stay alert and motivated. However, individuals with GAD often anticipate disaster and are overly concerned about everyday matters, such as health, finances, work, and family. These worries are often unrealistic or out of proportion to the situation. For example, someone with GAD might worry excessively about their health despite having no significant medical issues. The constant anxiety can interfere with daily activities, leading to a decline in quality of life. Generalized anxiety disorder is one of the most common anxiety disorders, with women twice as likely as men to be affected. Causes of GAD. The exact cause of GAD is not fully understood, but it is believed to result from a combination of genetic, environmental, and psychological factors. From a biological perspective, research suggests that GAD may be linked to imbalances in brain chemistry, particularly involving neurotransmitters like serotonin, norepinephrine, and GABA. These chemicals play crucial roles in regulating mood and stress responses, and disruptions in their function can contribute to the development of anxiety disorders. Genetics also appear to play a role in GAD. Studies have shown that the disorder tends to run in families, suggesting a hereditary component. However, it's important to note that having a family history of GAD doesn't guarantee that an individual will develop the disorder. It merely increases the risk. Environmental factors can significantly influence the development of GAD. Traumatic or stressful life events, such as abuse, loss of a loved one, major life transitions, or prolonged exposure to high-stress situations can trigger the onset of GAD in susceptible individuals. Additionally, learned behaviors and coping mechanisms can contribute to the development and maintenance of anxiety. For instance, if a child grows up in an environment where excessive worry is modeled as a normal response to life's challenges, they may be more likely to develop similar patterns of thinking and behavior. Certain personality traits have also been associated with a higher risk of developing GAD. Individuals who are naturally more prone to negative emotions, have difficulty tolerating uncertainty, or tend to perceive threats more readily may be more susceptible to developing the disorder. Symptoms of GAD. The symptoms of GAD can be both mental and physical, often intertwining to create a challenging and sometimes debilitating experience. People with GAD often describe their worry as a constant background noise in their minds, making it difficult to focus on tasks or enjoy everyday activities. They may find themselves constantly anticipating worst-case scenarios, even in relatively benign situations. This constant state of alertness can be exhausting, leading to fatigue and irritability. Physically, GAD can manifest in a variety of ways. Many individuals experience muscle tension, which can lead to aches and pains, particularly in the neck, shoulders, and back. Restlessness is common, with some people describing it as feeling on edge or having an inability to relax. Sleep disturbances are also frequent, including difficulty falling asleep, staying asleep, or experiencing restless, unsatisfying sleep. Other physical symptoms may include sweating, nausea, diarrhea, and a racing heart. Some people with GAD report feeling short of breath or experiencing a choking sensation, which can be particularly distressing. Trembling or shaking, especially in stressful situations, is not uncommon. It's important to note that the experience of GAD can vary significantly from person to person. Some individuals may have predominantly mental symptoms, while others may experience more physical manifestations of their anxiety. The intensity and frequency of symptoms can also fluctuate over time, often in response to life stressors or other external factors. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of GAD. Diagnosing GAD involves a comprehensive assessment by a mental health professional, typically a psychiatrist or psychologist. The The process usually begins with a thorough medical and psychiatric history to understand the individual's symptoms, their duration, and their impact on daily life. To be diagnosed with GAD, an individual must meet specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is the standard classification of mental disorders used by mental health professionals in the United States. These criteria include experiencing excessive anxiety and worry about various events or activities for at least 6 months, difficulty controlling the worry, and the presence of at least 3 of the following symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or sleep disturbance. It's crucial for healthcare providers to rule out other potential causes of anxiety symptoms, such as medical conditions or substance use. This may involve physical examinations or laboratory tests to check for underlying health issues that could be contributing to the anxiety. Treatment for GAD. The treatment for GAD typically involves a combination of psychotherapy, medication, and lifestyle changes. Cognitive behavioral therapy, CBT, is often a first-line treatment for GAD. CBT helps individuals identify and challenge the thought patterns that contribute to their anxiety while developing more effective coping strategies. Through CBT, people with GAD can learn to recognize and reframe negative thought patterns, practice relaxation techniques, and gradually face anxiety-provoking situations in a controlled, supportive environment. Medication can be an important component of treatment for many people with GAD. Antidepressants, particularly selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, are commonly prescribed. These medications work by altering brain chemistry to help reduce anxiety symptoms. In some cases, particularly for short-term relief of acute anxiety symptoms, benzodiazepines may be prescribed. However, these medications are typically used cautiously due to their potential for dependence and side effects. While professional treatment is crucial for managing generalized anxiety disorder, GAD, there are several strategies that individuals can implement at home to help alleviate symptoms. One of the most effective at-home treatments for GAD is the practice of mindfulness and meditation. Mindfulness involves focusing on the present moment without judgment, which can help break the cycle of worrying about the future that's so common in GAD. There are numerous apps and online resources that offer guided mindfulness exercises. Even just 10 minutes of mindfulness practice daily can have a significant impact on anxiety levels over time. Deep breathing exercises are another powerful tool that can be easily implemented at home. The simple act of taking slow, deep breaths can activate the body's relaxation response, countering the physical symptoms of anxiety. One popular technique is the 4-7-8 method. To try this, simply inhale for 4 counts, hold the breath for 7 counts, and exhale for 8 counts. Practicing this for just a few minutes several times a day can help reduce anxiety and promote a sense of calm. Progressive muscle relaxation is another technique that can be particularly helpful for those who experience muscle tension as a symptom of their GAD. This involves consciously tensing and then relaxing different muscle groups in the body. Not only does this help to physically relax the body, but it also serves as a distraction from the anxious thoughts. Regular exercise is a powerful anxiety reducer that can be easily incorporated into daily life. Exercise doesn't have to mean intense gym sessions. Even a brisk 30-minute walk can have significant benefits. Physical activity releases endorphins, which are natural mood boosters, and can also serve as a healthy outlet for stress and worry. Additionally, the rhythm and repetition of activities like walking, running, or swimming can have a meditative effect, helping to quiet anxious thoughts. Maintaining a consistent sleep schedule is crucial for managing GAD symptoms. Poor sleep can exacerbate anxiety, creating a vicious cycle. Establishing a relaxing bedtime routine, avoiding screens for at least an hour before bed, and creating a comfortable sleep environment can all contribute to better sleep quality. If racing thoughts are preventing sleep, some people find it helpful to keep a notepad by the bed to jot down worries, symbolically setting them aside for the night. It's important to note that these home-based approaches should complement, not replace, professional care. Now we want to hear from you. Do you or someone you know have chronic anxiety? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.